Hi, friends. I want to continue our conversation on the topic of diabetes type 2 and how to treat it. And today I will concentrate on the health of the digestive tract, and you will understand in a second why. When we eat carbohydrates, they get inside the cell, this is inside the cell, and sugar through the Krebs cycle goes and creates the energy. In order to create this energy, sugar needs to be utilized. It needs to be broken down. And look how many different nutrients we need. B1, B2, B3, B5, magnesium, lipoic acid, and more here as sugar goes through the Krebs cycle. Need B7, B9, vitamin C, coenzyme Q10, zinc, iron, copper. If those nutrients are absent, that means that the sugar cannot be utilized. It will be staying in the bloodstream, and that is detected as a diabetes type 2. Now, that sugar may be not broken down because the lack of those nutrients. Vitamin, as I said, B1, B2, B3, B6, magnesium, and other nutrients. Why they don't absorb? Because you have an inflammation in the digestive tract. So I will look briefly here and give you some suggestions. By the way, I want to say one word. What does it mean that I have an inflammation? How do you know? I know that because person will complain. They will complain about burping, acid reflux, epigastric pain, means that inflammation in the stomach. They will complain about gas, bloating, indigestion, poor appetite, diarrhea, constipation, or diarrhea and constipation together. So all of those are symptoms of inflammation. Think about what in your particular case can cause inflammation in the digestive tract. Here I will give you few suggestions. Number one, some drugs such as PPI, proton pump inhibitors, they block production of hydrochloric acid, non-steroid anti-inflammatory drug. The other possibilities, some chemicals may irritate. Example, Splenda. Some common food like IBS and IBD, think about elimination of dairy, wheat, soy, almonds, a possibility. Think about problem with functional deficiency of digestive enzymes, treating the constipation. Maybe dysbiosis is problem because you took antibiotics in the past. Consider taking aloe vera and butyric acid. Now, I'm done, guys. For people who are watching my YouTube videos, the rest of the explanation at the blackboard, and I will explain you why you need to treat digestive tract if you have a problem and you want to combat diabetes type 2. Okay, let's go there. I already draw, as always, my favorite picture of the digestive tract. This is the mouth with the teeth. This is esophagus, low esophageal sphincter, stomach, small pylorus. Suppose person is taking a PPI, stays for proton pump inhibitor, and the drug blocks the production HCl. And concentration hydrochloric acid will go down. As a result, protein is not going to be digested. So you put here meat or fish, and protein is not digested here in the stomach. As a result, magnesium, for example, is not going to be available for the absorption. What that means that protein together with magnesium will go through the digestive tract, will end up in the large intestine, and eventually will go out into the bathroom. All right? So let's draw. So the person is eating food, and here's comes all the nutrients, and person has an inflammation. Enterocytes in the digestive tract are usually looked at nice and square, and their job is the nutrients that are broken down actually, like magnesium, vitamin B1, B2, B3, supposed to go inside the enterocyte and then through the enterocyte get released into the bloodstream. Let's draw the bloodstream as a red. Here is our red pipe, which is a bloodstream. Okay. And here is our nutrients right here in the bloodstream. Okay, vitamins and magnesium. Yeah. And by the way, and here is the sugar floating that get absorbed into the bloodstream through the digestive tract. So all of this nutrients and sugar will go into the cells. And as I already said, in the beginning. So sugar will go here, will go into mitochondria. So this is our sugar, get incorporated and get broken down in the mitochondria, and the energy get released. So energy, and that's the energy that we need to exercise, our heart needs to work. But as I said, in order to break down this sugar inside the mitochondria, you need micronutrients such as B1, B2, B3, B6, B12, magnesium, and many other nutrients. If they are not there, then sugar is not broken, energy is not released, so sugar stays in the bloodstream and the concentration of sugar is going up. Here is the sugar on the laboratory work. So hemoglobin A1C, year after year, keep going up and up and up. And the patient may complain through all these years, oh, I just don't have enough energy, I cannot think straight, because energy is everything, from energy from the sugar. It's cardiac contraction, it's our ability to exercise these muscles, our ability actually and go and do something. Now, so energy not released, sugar is going up. The problem is not that you don't have energy. The problem is not that your sugar is going up. And that often people think, oh, it's because maybe I don't eat enough those nutrients. So they start to drink, vitamins and shakes and all kinds of blend of vitamins and minerals. The problem actually is here in the digestive tract. You put all of these wonderful nutrients here, and they just not here in the bloodstream. They are not here in the cell. Okay? So what I want to say is very important. If person has a diabetes type 2 or pre-diabetes type 2, you see that year after year, hemoglobin A1C goes 5.9, 60, 6.1, 6.23, and then person has a diabetes. And person has a digestive complaint, such as IBS, IBD, taking PPI proton pump inhibitors. Think about this possibility. The problem could be not absorbing those nutrients. So you put them there and they are not end up here in your individual cell, means that they are lost because digestive tract has an inflammation. So all these wonderful nutrients go straight in the bathroom. Okay, I hope, guys, I made the case clear. Any questions? Ask me right here. Bye-bye for now.